Coda TV, reconciling humanity to the source. Stay blessed.
So, Sister Margaret.
Yeah, my question is about cancer patients' death. Like, how did the doctors get to know that within these months, within these years, you aren't going to make it? And most of them that they put the death time on, most of them they had already lost their hair. Yeah, so I want to know how they get to know that this time you are not going to survive, and you have this many years like to live on the earth.
So like I said, cancer, we have stages in diagnosing it. So stage 1, stage 2, stage 3, and stage 4. With stage 1 to stage 2, we know that we are going to cure you. So the plan is cure.
Okay.
Yes,
okay.
Is to cure you from the cancer. So we do everything possible to cure you from the cancer. And equally, based on the sites that the cancer is located, even some stage 3 cancer patients receive curative treatment.
Based on the sites.
Yeah, based on the sites. Stage 4, we know that the cancer has advanced. It has spread to other organs. So organs are failing. It has spread to maybe your brain. So your brain is equally failing you. Maybe you go for radiotherapy. So the radiotherapy will not be to cure you, but it will palliate you. It's to relieve you from the pains you are going through. It is to possibly stop the bleeding that you are getting. It is to actually relieve you from the symptoms and give you quality life. So we are targeting the quality of life of the patient so that you die in peace, not in pain.
Okay.
In peace, not in pain. So we have what we call palliative care. We suggest that palliative care commences from the diagnosis of cancer treatment or any kind of chronic disease. Palliative care commences. So palliative care does not look at only the physical aspects. It looks at the spiritual aspects. It looks at the psychosocial aspects. It looks at the compressed nature, the embodiment of the patient, holistic nature of the patient. Then we provide palliative care. Then as the patient is getting to the end of life, then we set in with end of life care. End of life care is different from palliative care. There are two different components altogether. End of life means we now know that within 3 months the patient is going to die. We will start discussing this with the patient and the family. We start having death and dying conversation with the family. Then we prepare them to receive death as it approaches. So we also have what we call advanced care planning. Advanced care planning is we want to meet the wishes and the preferences of the cancer patient. Possibly the cancer patient will say that the treatment is becoming excessive for me. So when I'm getting to the end of life stage, I don't want to receive surgery again. I don't want to receive chemotherapy again. I don't want to receive palliative care again. I want to die with my family members surrounding me. And this is the end of life plan. And equally, the patient can say that, okay, I want to die at home peacefully in the comfort of my bed, with my dogs around me, with my cats around me, with my family members holding my hand. I don't want to die in a hospital. I want to die in a residential aged care facility. So this is the plan that will be put together as the patient advances towards death. It is very, very important to adhere to the wishes and preferences of the patient. if the patient says that when I'm approaching death at the terminal stage, I don't need any CPR.
Not even a family member.
Yes.
Or anything like that.
We have to obey that preference.
Doctor,
So it is important to monitor all these from the patient, document it, and follow it at the end of life.
So let me ask you this. I'm just throwing this in. People always talk about eating canned foods as something that could create complications like cancer.
Yes.
We keep hearing a lot of stuff. Trust me, I believe we're going to be having more sessions, and viewers are going to be chucking a lot of comment feedback under the thing when they watch it, and we will get more coming from every other person. So is there any truth in that, as in eating canned food?
One risk factor of cancer is, particularly in those of us from low income countries, is lifestyle or westernization or lifestyle. The junk food will equally expose you to obesity, and obesity is a risk factor.
Okay.
So my advice is minimize or eliminate the intake of junk food. That's why in Western country nowadays there are even campaigns against junk food, particularly in US, and I know in Australia they've started, and they even started the content of sugar in certain drink should be monitored. So certain drinks now you have no sugar or sugar-free drinks. So please, let's reduce the junk foods and also the time that we eat. Some people eat around 10:30 p.m. Just after eating, the next step is they are going to bed.
Going to bed.
Yes, the next step is going to bed. So let's monitor the time that we eat and the time that we go to bed. At least after eating, spend some time, let the food digest.
Is it good to watch TV after eating before you go to bed, or you have to do some walking around?
At least you should have some walking in between, not just sitting.
Chucking in one corner.
Being physical activity is very, very important, because physical inactivity is a risk factor for cancer.
Okay.
So we recommend that you exercise regularly, you eat healthy meals, you take in fruit and vegetables, you see your doctors when you notice changes in your body.
Viewers, we've seen a lot. Yeah, someone can go
There's
for it.
another question that I want to ask. I know that with breast cancer, when it happens at a specific area, there is a surgery performed that only that portion will be taken out, and there is one too that they can take the whole heart. So like, I want you to take me through the surgeries for either any of the cancers, especially breast cancer.
Yes.
Yeah.
So it all comes down to the stage. The stage of the disease is very, very important to your cancer specialist, either the surgeon or the radiation oncologist or medical oncologist. It's very, very important to them. Without the stage, there is no way you'll be able to plan the treatment or the care of the patient. So the stage will determine if we are to do mastectomy, as in remove the breast, then even the tumor, then the underlying muscles, you remove it. So you can have even radical mastectomy, where you can even go to the armpit and you remove the lymph nodes. So it is all depending on the stage. Then you can have lumpectomy. The lumpectomy is, we are just interested in the lump.
Oh, okay.
We are interested in the lump. So the surgeon will go in there, cut and take out the lump. So
is it the tumor?
The tumor.
Yeah.
You take it out because it has not spread to other sides.
Okay.
So there is no need for me to take out the entire breast.
Okay.
So the focus is just the tumor, take it out. Then based on, after taking the tumor, we will send it to a pathologist. then the pathologist will perform examinations and say, okay, you've taken it out, but it is good for the patient to go for what we call radiotherapy, so that if the surgeon eye could not take one cell that may be cancerous, that has the potential to divide and become big, let's use the radiotherapy to kill the cancer cell that we could not take it out after the surgery. So the treatments, they complement each other. They support. So surgery, we are not saying surgery is superior to radiotherapy, and we are not saying radiotherapy is superior to surgery, and we are not saying that radiotherapy is superior to chemotherapy. They work, yes. There are stages that you can receive the radiotherapy first to shrink the tumor.
Then the surgery.
There are stages that you will be given the chemotherapy to shrink or make the tumor sensitive to radiotherapy, so that you radiate and it will kill the cancer cells.
So if I understand really well and what I'm thinking is right, it looks like the key to cancer is early detection.
Early detection saves lives.
Early detection.
Yes.
So it means that we need to be our own doctors then, so that we can actually monitor ourselves. If there are any changes, we can actually report it quickly to our doctor, and he can refer us to the appropriate.
Yes, that's why we are embarking on this education. Just want to empower the public.
Yeah.
Let them know what they should expect when cancer is emerging.
That's right.
We are empowering you with evidence-based information, so that the public will know the facts out there and be able to differentiate the facts from the myth.
Yeah.
Because there are also myths out there. So if you follow the myth, you will rather be using herbal medications that may complicate the issue, and by the time you get to the hospital, your doctor may not be able to provide you with the curative treatment we are talking about. Every life matter. Yes, with cancer treatment, we want to save every cancer patient that walk into our doors. We want to give curative treatment. We want to give quality treatment. We want to see our patient coming back with their children after 5-10 years of treatment. It brings joy. We want to have survivors, a group of survivors. We don't want cancer to be like a death sentence, but rather, if you are diagnosed, we want to assure you that we have the expertise. We have people that have been trained over the years, and they know what to do to cure you from cancer.
Last time you were saying that pain is the last thing that you feel like during when you are diagnosed with cancer, or you have the cancer itself. So in case I'm feeling some pain within my breast, either right or left area, should I be concerned, or maybe it's just the muscles within that area that is making me feel that pain? Or it could be related to breast cancer, because you said pain is the last. So if I have I'm developing breast cancer, I shouldn't expect pain, right? But in case, what if I'm feeling pain within one of my breasts, or either both of them? Pain, is it related to breast cancer or something different?
Just to clarify it, I'm not saying you should not be expecting pain, or pain is something, the last thing you should see or experience. But most of the time, the information out there is, when cancer is emerging, if it is not pain, then it is not cancer. They are expecting to experience pain before they go and see their doctor. Though they've noticed a lump, but because they are not feeling any pain, they consider it that, okay, it's not serious, so let me forget about it. It will go. The lump will disappear. Although they've noticed that there is a discharge when they touch their nipple and squeeze it gently, they've noticed that discharge. Because they are not feeling the pain, they said, okay, there's nothing wrong with me, so I'm not seeing my doctor. They've noticed wound that is not healing around their nipple, because they are not feeling any pain, they say, okay, there is nothing wrong with me, so I'm not seeing my doctor. They are waiting till they start experiencing a pain that they cannot endure.
Okay.
And before you experience that pain, it could be too late for you.
Okay.
So don't wait. When you start seeing these symptoms, don't wait to experience an unbearable pain before you consult your doctor at all.
My question here again is this: is cancer a spiritual disease?
For Africa, we tend to actually direct everything to spirit. But from my medical background and my understanding of the body, and the way I've explained to you that the cancer originates from the cells based on mutation that has occurred, and the cell could not receive messages or signal to prevent it from continuous division, but rather starts dividing at a rapid pace, then gradually form a tumor or a lump that can invade other organs or travel through your system to either other part of your body. So as a medical professional, cancer is not a spiritual disease.
That's right.
Cancer is not a curse. Cancer is not because somebody wants your downfall. That's why he or she has gone to a juju person to actually bring you down.
Okay.
But cancer is due to risk factors that we've mentioned. It could be aging, it could be family history, it could be your lifestyle, alcohol intake, smoking, it could be a previous medical treatment that you've received. It could be because you've even received another cancer treatment. So there are several risk factors. It could be your work environment. You've been exposed to asbestos. So these are the risk factors. There is no book that has written that or indicated that spirits or curse is a risk factor for cancer.
That's right.
So I'm saying, know your body, identify any abnormality that occurs, and as soon as possible, consult your doctor for early diagnosis and treatment.
Thank you so much. Viewers, I believe we've gathered a lot of information, but then I will be expecting to see your comments, your feedback, your questions under the video down in the comment section. Dr. Andrew will be around. He's going to be giving us a lot more information than you ever expected. So I will encourage everyone to just keep bringing in your questions, your comments, feedbacks. And then if you are also an expert in this area and something you want to give us, if you want to also come join us one day in the studio and you also share your experiences, that will be welcome. And even if you are a victim that has recovered from cancer and you want to encourage someone, you are on a campaign, this place is your place. Come, let's educate ourselves and make the world a better place for everyone. Thank you so much.
Koda TV, reconciling humanity to the source. Stay blessed.